To finish off this chapter, we talk about when some things go wrong. Okay. And when some things go wrong, we're just talking about muscles, and usually it's things like a strain. You strain muscles. Think you sprain joints, but you strain muscles. And strains typically occur in people who are very active. So think athletes, some like runners. I mentioned runners do things like strain their hamstrings. And whenever you strain a muscle, you might know how to help treat it. One thing is you're going to have to help kill some pain. That's the job of things like NSAIDs. Think Tylenol. If it's a chronic pain, you might need things like steroid injections. If it's a serious strain, you might need to do some rehabilitation, some rehab, some physical therapy. Might need to ice it, elevate the strained muscle to help rehab it. But we want to focus on specific, more urgent injuries than a strain. There's something called compartment syndrome. I want you to know, what is compartment syndrome? You see this usually in things like crush injuries to muscle. Kind of think if you were to get your leg pinned underneath a car or a motorcycle. That's a crush injury. This might generate a compartment syndrome. What's happening here? In compartment syndrome, you've damaged not only muscle, but also blood vessels. And the blood is going to leak out. But the skin is still intact, so the blood has nowhere to go. It's going to stay in that area. It's going to stay in that compartment and begin to squeeze surrounding structures, like muscles or even nerves. This is compartment syndrome. It's when blood compresses structures within a compartment, within an area. We saw things like the thigh gets broken up into compartments: anterior, posterior, medial, and lateral. If you were to have a crush injury to the anterior part of your thigh, you might get a compartment syndrome in the anterior part of your thigh, where blood will crush not only the muscles, but also blood vessels, because the blood can't get out. So how do you treat it? You've probably seen it on TV. It's not going to be pretty. You're going to have to drain that blood out in an emergent situation. You're going to have to cut that person open and allow the blood to ooze out so that it's no longer basically strangling the structures in that compartment. So that's compartment syndrome. So when blood vessels break, blood leaks out and crushes structures in the compartment. And this could lead to things like paralysis if you crush and damage nerves too much, or paresthesia, meaning you become numb, or also pain as well. Pain or numbness could occur. So that's compartment syndrome. You got to drain out the blood. And then to finish off this chapter, we look at one more thing that could go wrong. It's something called plantar fasciitis. You see this a lot in runners. Plantar fasciitis kind of gives you a name a hint in the name. Plantar. Remember, your plantar region is the bottom of the foot. So this is something going on in the bottom of the foot. Think the sole of the foot. Fasciitis is for fascia, which is connective tissue, and itis is inflammation. So if you broke down the name, it literally tells you what's going on. It's inflammation occurring in connective tissues in the bottom of the foot, the sole of the foot. And this could be painful. It's due to chronic irritation. I told you this is in runners. When you run, you're stressing out not only the muscles in your feet, the bones in your feet, but also connective tissue in the feet. And we name this one sheet of connective tissue located on the bottom of your foot. It's called your plantar aponeurosis. This is just the name to the connective tissue sheet along the bottom of the foot. It's deep in the foot, deep to your skin. And when you run, it gets irritated and it becomes painful, and we call that plantar fasciitis. And it's easy to treat. You're just kind of irritating it. It's an inflammation problem. So you want to do things very similar to a strained muscle. You want to take your NSAIDs, take your Tylenol. You want to ice it. You want to elevate it. If you need to walk, you can have a prosthetic, but don't think fake foot. This prosthetic is more of a boot. You want to wear a hard-soled shoe. Think a boot. If you see someone with a boot on, they might have plantar fasciitis, or they'll just be wearing hard-soled shoes. Okay. shoes with a hard bottom, a flat hard bottom. Those are hard-soled shoes. And again, if it's a chronic problem, having it for a long time, again, those steroid injections might work. Or in extreme cases, they'll have surgery where they'll kind of cut through the aponeurosis to loosen it up a bit or partially remove it. So that's plantar fasciitis. It's just inflammation of the connective tissue plantar aponeurosis on the bottom of the foot, usually due to chronic overuse, think running. How do you treat it? Ice it, elevate it, take your NSAIDs, your Tylenol. In extreme cases, you might want to have steroid injections or therapy, or wear your boot, your prosthetic. So that's a little bit on muscles, the organs, and that's chapter 11.